Ever woken up to find your bed wet but don't know why it's happening? As kids, we never knew why we wet the bed. We just prayed every night it wouldn't happen. If you wet the bed, you'd know the shame is out of this world. Let's explore the causes of bedwetting in children and adults, and most importantly, how to stop it. Bedwetting, also called nocturnal enuresis, is the accidental release of urine while sleeping. It is common among children, but adolescents and adults suffer from it too. Bedwetting is normal when it happens to children below 7. However, it becomes an issue when the child is above 12 and wets the bed 2-3 times a week. There are two types: primary enuresis, secondary enuresis. Primary enuresis is without cause when the person hasn't been dry for 6 months or longer. Secondary enuresis has an underlying cause. It is the sudden start of bedwetting after 6 months of not experiencing it. What are the causes? For kids, it's mostly a lack of bladder control. For adults, it can be a result of genetics, constipation, hormonal imbalance, small functional bladder capacity, emotional or psychological problems, failure to awaken during the night. Recurrent bedwetting can also be a sign of underlying conditions like urinary tract infection, diabetes, obstructive sleep apnea, ADHD, narrow urethra. How do you stop bedwetting? For kids, know that it's normal and a part of growing up. Encourage them and don't shame them when it happens. Give them bathroom training. Limit drinks or water at night. Set an alarm for when they wet the bed. Children gradually outgrow bedwetting as they become more aware of their bladder function. For adults, identify any underlying condition and treat it. Talk with a mental health professional or psychologist to reduce your stress or emotional challenges. Use an alarm that wakes you up at night to pee. Some medications can reduce urine production. Meet a professional for that. Don't take alcohol or drinks before bed. Bedwetting can be a stressful and emotionally draining event. This is due to the shame and social stigma associated with it. As an adult, occasional bedwetting is normal, especially if you had so much to drink the previous night. However, when it occurs consistently for at least 3 months, there's a problem. What to do? Find out what might be the cause. Become more aware as you try to stop. Don't shame yourself, as that might lengthen the process. Speak to a doctor or therapist. Incorporate some behavioral changes. The good news is that bedwetting can be controlled with the right techniques.